I believe that means that we are okay. On my computer. And then we're set to go. Thank you for your patience.
Good.
We're good. Yes.
Okay, I call the meeting to order. Today is 7:33.
Adequate notice of this meeting pursuant to the Open Public Meetings Act was posted on the bulletin board at City Hall on the city's webpage, distributed to the record and filed in the office of the city clerk.
United States of America.
And to the republic for which it stands, under God, indivisible, with liberty and justice for all.
Roll call. Ms. Davis. Ms. Rubin.
Here.
Dr. Sadler. Present. Dr. Silfer.
Here.
Mr. Tenzer.
Here.
Dr. Solomon. Here.
Okay, moving on to item 2, items for approval, which is the board's consent agenda. We'll bundle items 2A through 2B for approval, which includes the minutes of the October 9th, 2025 meeting, revenues of $19,631 for October 2025, expenditures of $10,664.02 for October 2025, and employee reports for October 2025. Board will need a motion to approve in a second.
Motion. Second. Ms. Davis.
Yes.
Ms. Rubin.
Yes.
Dr. Sadler.
Yes.
Dr. Silfer.
Yes.
Mr. Tenzer.
Yes.
Solomon.
Continuing to item 2E, retail licenses for October 2025. Is there anything about these licenses the board should be made aware of?
No, they're all in compliance.
Moving on to item number 3, which would be the presentation.
Need a vote on it
We need
to
a-
approve.
Oh, I'm sorry.
Ms. Davis.
Yes.
Ms. Rubin.
Yes.
Dr. Sadler. Dr. Silfer.
Yes.
Mr. Tenzer.
Yes.
Dr. Solomon. Yes.
Now moving on to the presentation. Please.
Good evening, everyone. It's great to see you all. So Susie and I are back. We'll be going over some updates, some highlights of the activities and programs that we did in 2025 till now, and some accomplishments. Since Susie and I started working in under the opioid settlement funding grant, we wanted to go over a little bit of what we do here, what we started doing in with a little bit of focus on opioids, on top of what we were doing initially under the strengthening of health capacity grant. So just a little bit of background on opioid epidemic itself. It started, all of this started back in late 1990s when the pharmaceutical companies were saying that, were reassuring the medical community that patients would not become addicted to the prescription opioids, pain medications. And then there were increased use of prescription opioid medications, which led to use of increased use of opioid meds prescribed, but as well as the non-prescribed opioids. So what we can see here on this graphic is there was a first there was a rise in prescription opioids in late 1990s, prescription opioid overdose deaths in late 1990s in the teal graph, and then After a few years in 2010, we saw a rise in heroin, semi-synthetic opioid, which started in 2010. The rise in the deaths of with heroin grew in 2010. And then the more prominent one in purple, the rise in synthetic opioids, so fentanyl, tramadol, and others. So it started picking up in 2013. So all of this represents the opioid epidemic altogether, and the number of opioid involved deaths increased substantially since it's been 25 years. But the good thing is since 2023, the deaths all over US, except in a few places, have declined. So which we can see on this slide. So this is a good thing. So all the blue and dark blue ones, it's percent decrease in opioid drug overdose deaths. So except in South Dakota and Arizona, everywhere, all other states in the US saw a decrease in deaths. So in New Jersey particularly, when the reported overdose deaths were compared from end of April 2024 to April 2025, there were around about percent of 31 or 32% decrease in opioid overdose, drug overdose deaths.
Does that take into account population increases and decreases in states, or that's just an absolute percentage?
So that should take into account. And touching a little bit on opioid settlement, so when it started, so when the synthetic opioid overdose deaths rose, spiked, we saw in earlier slide. After that, in few years down the line, Department of Health and Human Services declared opioid crisis as public health emergency. And to address the opioid misuse, drug-related overdose deaths, many efforts started all over the nation, and one of the main ones were the nationwide opioid litigations, which started around 2017. A few started before that, but the major ones and nationwide started in 2017. So in New Jersey specifically, the settlement payments began in 2022, more recently, and New Jersey will be receiving more than 1 billion in settlement funds to be paid in different allotments through 2038. So the total funding New Jersey receives will be split 50-50 between the state and the eligible subdivisions, which includes the counties and the municipalities or boroughs. And the settlement funds, the opioid settlement funds will proceed state and local programs focused on treatment, prevention, and other strategies to combat the opioid epidemic. So coming to our local stats, we don't have exact numbers or on how many overdoses occur on any of those years in Englewood, but we got this from a website, a New Jersey SUDOR, Substance Use Disorders website. So there were on the left-hand side, we see Narcan administrations by law enforcement and EMS in Englewood. This is Englewood specific data. So from 2020 to 2024, it's about 22. We can see the range 22 to 30. Those are the ones administered by law enforcement. So we do not know what happened in someone's homes or outside of law enforcement or EMS. For one specific year in 2022, I saw data, however, it was so 19 doses were administered, but it was 2.5 times more, so 50 overdoses occurrences recorded, but I don't have the data for other years. And on the right side, the table, we see drug overdose deaths. So that data is from our vital statistics unit, and it is showing how many deaths due to overdose has occurred in Englewood over this 5-year period. So it's 5 or either less than 5 in those years. And when like looking at all those death certificates related data from the vital stats, we saw that drug induced deaths or drug related deaths many times or more often than not included alcohol use. So we made a note that with or without alcohol use. And so for overdose prevention, opioid overdose prevention and response, we've been doing some activities and just wanted to highlight some of them, like especially the health education unit. They continue to integrate opioid overdose information and distribute Narcan kits at all possible community events. So whenever we are outside, we continue to refer individuals and families with addiction and support needs to treatment and our social support agencies. We have been promoting harm reduction measures. Either it could be by distributing little sharp containers, or if we have any supply of medication disposal bags, those. And then Englewood being stigma-free town, we always integrate that component into our outreach efforts to reduce the stigma around substance use disorder to promote treatment-seeking behavior. And some of the activities that may be coming up in future, we are looking into it, is training for our staff, could be a couple of our staff. So to complete the naloxone administration trainer program so that we can be certified and we'll be able to conduct the naloxone training, which will include a little bit of background information on opioid overdose problem itself. And then we'll also look into placement of Narcan kits at city buildings and some other locations in the city. And here's some pictures from this year. So on August 31st, we did that a few days before. So on observance of International Overdose Awareness Day, we had the flags and lawn signs placement to raise awareness. Health ed team do the monthly outreach outside Chick-fil-A and Broadway Cafe in partnership with Ron from Bergen County, Hopewood, Bergen County, so to give out the Narcan kits. And this one, I think you all know, the Englewood Municipal Alliance and the Center for Alcohol and Drug Resources partnered with Buster Bucks at McKay and installed these Buster Bucks at McKay Park on September 25. So it has about 20 naloxone kits. It came with around 15 Narcan kit boxes. And this campaign, Buster Bucks campaign, was launched in 12 towns in Bergen County in September, and was named in honor of Buster Spike Lukey Elkin-Murray, who died of fentanyl overdose in 2021 at age 24. And we used to cover a little bit of stats on reportable infectious disease and COVID. So I just have one slide on that. So just a quick update on COVID-19 cases compared to 2024 as of like yesterday, 11/11, we had about I think it's about 40% of the cases that we saw in 2024. So 471 cases of COVID till date. And other reportable infectious diseases, as usual, we do see some foodborne illnesses, more commonly Campylobacter, Salmonella, non-typhoidal. A few hepatitis B and C cases, or sometimes, or only once in a while, Hep A cases could come up. And respiratory illnesses, influenza is common. It hasn't quite picked up yet, but we are seeing some reports in some educational facilities here. And then we do see one or two, sometimes monkeypox, pertussis, vaccine-preventable disease, vector-borne disease, especially Lyme. We do see a few of them all year round. And then some other bacterial infections. So in addition to these reportable communicable diseases, we do get a few reports of outbreaks, especially of COVID, flu, hand, foot, and mouth disease, and norovirus at long-term care facilities and child care centers in Englewood. And coming to the flu vaccine clinics, for this flu season, so several flu vaccine clinics were organized at different locations. We hosted 2 here for adults and children. One at the Lorenzo Food Group, at the health fair on October 5, at the library, its annual clinic, and at the Office of Concern, there were 3 clinics held. So to date, from ESD, there were 132 doses administered to 19 and older, and then 31 doses to the children during the annual children clinic plus the regular child health clinics. And outside of this, 25 flu vaccine doses were administered by Bergen County Health Department during Englewood events, at the health fair, 6 doses, and at the other community outreach event outside Broadway cafes, 19 doses. Susie will go over the other events.
Everyone. Okay, so I'm going to briefly go over all of the health education unit events that have happened thus far in 2025. So to start off, I did give the stats. So comparing back to 2019 until now, from January until October, we have about 119 year-to-date outreach events. It is a bit of a decline from last year, but there have been some things and some occurrences that were out of our control this year. So we have seen the decline in attendance rate. But so far, you know, we're at 119 till October, so it's pretty good so far. Okay, so to start off the year, we did start off with the Englewood 2nd Annual Nutrition Month Challenge for the city and Englewood Public School District employees. So the first year we started this program, we had about 21 people that signed up. This year we had 39. We had about 7 teams. We did get great feedback. A lot of people did enjoy it, and they are looking forward again to it this year. So just briefly, this is a 30-day challenge that every week they meet weekly for 60 minutes with the nutrition counseling. It's one-on-one. Every week there are 7 daily wellness goals and personal goals. So you also, it's like a point system. So you're individually earning points as well as part of a team. And this year we did get to partner with 6 local businesses to offer discounts throughout the month. So a lot of the employees were able to get discounts, not only at restaurants, but even at fitness centers as well. So Spring into Wellness Challenge, it was from May 6th to June 12th. Partnering agencies, Englewood Parks and Recreation, Gym Guys, the Sherman Family Livable Center, Rico Water, they're the best, they always participate with us. Hope One Mobile Unit, and the Connections Project of the Community Chest. This year we had 58 participants. The program was 2 days a week, again, Tuesdays at 10 a.m. and Thursdays at 5:30. So just a brief comparison compared again to the previous years. So in 2018, as you can see, it was 64. 2019, we had 70. In 2020, you know, it was canceled due to COVID. 2021, it was 40. 2022, 45. 2023, 53. In 2024, we did spike up to 81. And this year, we did have 58. Again, that is when we start seeing the decline in people participating with things that are out of our control. So just so that we do keep that in mind going forward. So once again, for the 2nd year running, DePika had the walk and talk with the health providers, a great turnout, a lot of great feedback as well. Everyone enjoyed walking outside with the providers, the nutritionists, dietitians. Hopefully happens again this year again, next year, 2026. So water wellness, our big hit. So location was McKay Pool. The days and times, we had Tuesday mornings at 11 and Thursday 7 p.m. We had 102 participants overall. So approximately out of those participants, 80% of them are Englewood residents, were Englewood residents. Again, the partnering agencies, Englewood Parks and Recreation, Gym Guys, the Sherman Family Livable Center, Rico Water, and the Connections Project of the Community Chest. So something new, take control of your health. This was held in Cecil, and the instructors were our health educator, Julie Green, and our senior REHS, Priscilla Lewis. This is a 6-week free workshop that is offered. we had 12 participants. 11 of the 12 received gift cards and certificates. In order to receive those, you do have to attend the classes for a certain amount of times. And we are looking to have it again. So anybody that is interested in participating, please contact our health educator, Julie Green. Her phone number is 201-568-3450, extension 508, or healthed@englewoodnjhealth.org. So these are some other programs that we had going on. Healthy Kids, Happy Families at Ebenezer Summer Camp, and also something new that our health educator Julie has started, which is called Wellness Wednesdays. So we take time during our lunch break here in the department to kind of just have a self-care moment for 30 minutes. Has been very helpful, very mindful for all of us. So we're looking to hopefully expand this out into the future. Now, the Englewood Family Festival, the highlights. So this year we had 34 organizations participate. Of those 34, 3 were mobile units. So we had Team Management 2000, which provided free HIV, hepatitis C, BMI, blood pressure, and glucose screenings. Buddies of New Jersey offered HIV, STD, and STI testing, and they did offer free $10 gift cards for anyone that did get tested. And also we had Screen NJ Lifesaver mobile unit that provided breast, prostate, lung, and skin cancer screenings. For the free flu vaccines, we had our public health nurse there who administered 33 vaccines, and then we had Bergen County Department of Health Services that they administered 6 and completed 9 health screenings, which I believe were blood pressure related. Now, based on the vendor feedback, attendance was estimated at about approximately 150 to 200 people at the event. And also, just so everyone is aware, unfortunately, Screen NJ is no longer around. That was their last event. They were shut down due to funding. That was their last event with us, and they had about 10 people that they screened. So Englewood Family Zumba Night, we partnered with Englewood Parks and Recreation and Englewood Public School District. The location was Dwight Morrow High School Gym. The time 7 to 8 p.m. The trainer was a Zumba instructor from the gym guys. So as you can see in the bubbles, those were actual comments from the participants. 33 people registered for this event, but due to weather, only 20 participants had attended. The weather was a little bad, but it was still a great turnout. And we are looking to have another one pretty soon again. We're just trying to iron out the date and time again. But as you can see, those are the comments of participants that they left about the program. Now, Get Fit in the Fall. This is one of our last activities for the year. Maybe not, who knows? But free community sessions. So we already did our Tai Chi by the pond. It was a very good turnout at Flat Rock. Now what we have coming up is Get Fit in the Park with Gym Guys. So that'll be in McKay Park. That will be held on Tuesday, November 18th, as well as Thursday, November 20th. Then we have Get Fit with Dream Fitness. So that's an indoor event that will be held in Dream Fitness right here in South Van Brunt. There are 2 sessions for that day. So it'll be an 8 a.m. or 11 a.m. session. And that will be with a personal trainer as well. And then we have, again, Get Fit in the Park in McKay Park on November 25th. So the upcoming events are outreach for 2026. Radon awareness program. So wanted to provide some feedback about it, provide a definition. So radon is, So radon is a radioactive gas that comes from the breakdown of naturally occurring uranium in soil and rock. It is invisible, odorless, and tasteless, and can only be detected by specialized tests. Radon enters homes through openings that are in contact with the ground, such as cracks in the foundation, small openings around pipes, and sump pits. On September 3rd, we received approval for the radon grant. Englewood did receive the approval for the radon grant. The reimbursement for it is up to $2,000. According to the grant guidelines, we must retrieve 3 quotes for the radon kit and select the lowest. It is a yearly grant, so we must apply every year. And the amount reimbursed is the same for every applicant. So it's the same amount for every town that does apply. Now, today, September 12th, a requisition was made for 175 radon test kits, which include shipping labels and laboratory testing. So once we receive this, the Englewood Health Department will have only 175 radon kits available. A flyer with details on how to obtain a radon kit will be posted and shared soon. Additional information will also come with that. So, blood drive. Sign up. So we're starting off the year strong. New year, new resolution, a life-saving impact. It'll be held, so in honor of National Blood Donor Month, which is January, we are having a blood drive on Friday, January 23rd, from 8 a.m. to 4:30 p.m. in front of City Hall. It is a great thing to do. If we can all participate, that'll be awesome. The QR code is there. And that's one of the first. We will have another one in September as well. Rabies clinic. So Saturday, March 7th is our rabies clinic. The rain date is March 21st. It'll be from 11 a.m. to 1 p.m. and the location will be the Englewood Fire Department. If there are any questions or concerns, please feel free to contact our environmental unit that is there. And that is it. Do you have any questions, any concerns for Topeka and I?
Are we already planning out the next like family festival and wellness festival?
So, yes and no.
Okay.
So I would like to say yes, but I think that all depends on the staffing. Because it is a pretty, it's a pretty big event that does take up a lot of time. I don't want to say that something can happen and then, if we don't have enough staff for it, then it might not. But I'm helping Julie with planning certain things, within certain range. So that's where we're at right now. We will see what happens in the future. Hopefully, if everything goes well, then yes, it will be held again. And other things will be had that we would like to have that we wanted to have this year. But we just have to kind of wait and see.
I just want to say thank you for the information. It's great
Yeah.
information. It's nicely presented. It's clear. I learned some things. So as always, thank you.
Oh, yes. So one last thing, which I did forget to include in there. We did receive a grant for the mayor's wellness campaign, and it's the mental health initiative. We were considered a healthy town last year. We are going to apply again for this year. So with that grant, we are going to plan a lot of things centralized around mental health. So we will have 2 instructors that will be able to offer the mental health first aid training. So we'll be able to offer it in English and Spanish. And also we will have some sessions in the park. So maybe some sound baths, some painting. So things like that will be able to kind of bring about, mental health and stress-free environment. Any additional questions?
I would like to add something as far as the Narcan kits in the city buildings. This was approved by the city manager some time ago. However, the priority for the Center for Alcohol and Drug Resources is that there be a resolution by council approving this or supporting it. And so far, I have not been able to get it on their agenda.
In the meantime, going off of what Deborah said, in the meantime, we had already planned that with the Narcan train the trainer. Once we take that course and we're able to provide it in Spanish as well, we're going to go to the restaurants and have Narcan kit, hopefully in each restaurant with their first aid kits, and maybe train those that don't know how to use it.
So I have a question about the Buster box. So there are Narcan kits in the box and it constantly replenished. That was my question. Is there always going to be something in there?
Yeah, so I
Yes.
believe
Center for Alcohol and
yeah.
Drug Resources, they will
That replenish it. Okay.
But money has been taken to
Oh, that, I haven't checked, yeah, so, yeah.
We can find out.
But
and
we can let you know, yeah.
Yeah.
But they said, I think it was 45 to 50 that was filled, so we can go ahead and check and let you know.
And we do hand them out at all of our outreach events. So when we are with Hope One, they already have the Narcan kits there. So they're already giving it out to the community. When we're doing outreach on our own, then we bring the ones that we have. Thank you.
On to item number 4, board liaison reports and any reports tonight from any liaison to the council.
Yes, I went to last week's council meeting, not much events, but hot topic was reached planning. On for which they're going to use primarily to hire architects and planners. And then tomorrow, I believe there's a town hall on it as well.
Where we're gonna put it. The other thing.
It should be Liberty, or it should be somewhere central, because that's like the center of town.
The COG committee reports, are there any reports from any committees this evening? Item 6, all business communicable disease update. Jim?
I like Deepika's reports and I see them, but she sends them to me, yeah, so thank you for those, that's a good report. And my report, I talk a little bit about measles again, because measles it keeps happening. And one of the graphs. But it's easier to see in color. So there are several measles cases in my report. We talk about measles in South Carolina. So you see an outbreak in measles in South Carolina, and many of those were unvaccinated children. And over 150 were excluded from school, and they're excluded from school for 21 days, which is a long time, 21 days. Because they're unvaccinated, you could show proof of immunity, you could go to school, but those who don't have the vaccine or can't prove immunity have to stay home from school. So not only the kids home from school missing, but also somebody's got to watch them, especially if they're small children. And this, so my prediction is that you're going to see more of these cases of measles occurring in the United States because of this graph. So this is New Jersey, and you see Bergen County. It's kind of hard to see, but Bergen County is it goes alphabetical. So Bergen County is this one here. So from 10 years ago, there were about 2% with religious exemptions. Now it's up to about 4%. So it went from 2 to 4%. You see some of the other ones like Ocean County and Cape May County have more than doubled. So I expect to see that more. And so an interesting case here in Leonia was on Friday, Halloween in the afternoon, you got a phone call that my son was diagnosed with measles, and we're in Columbia right now, and the school district wants to know what to do. What should we do? Well, it's kind of like, oh my gosh, like, what are you going to do if the physician says the child has measles?
In Colombia, he was diagnosed, or
Was diagnosed with measles
in Colombia?
in Colombia, and the last day of school was October 29th. So what are we going to do? So this was the kind of phone call you get with measles. So of course, well, you got to start finding out who in the school is vaccinated, not only the kids, but also the teachers. And here in Englewood, the same, we have the 2 measles cases here in Englewood, the same thing is you have to start thinking about, okay, what happens if there is a measles case in the school? How quickly could we identify those who are vaccinated or not? So that's the part of my report. We talked about measles there. I think I did mention something about, vector-borne diseases. We're coming to the end of vector-borne diseases, and it's been a calm year this year, very calm, which is good. Um, So for West Nile virus cases, we only had one case, and that was associated with travel to Michigan. 2 years ago, we had a person in Bogota who died from West Nile virus, so, and there were 3 cases, and those were all locally acquired cases. So this year it's been quiet with vector-borne illnesses, but it hasn't been quiet with measles because it started in February and just continued like the last. That, by the way, that ended up not being the case, the one that was called in on October 31st. So that was a big relief.
Or even with the increase in deer population, no increase in Lyme.
So with Lyme disease, I think I had put in there with Lyme disease. So thank you. So, on Lyme disease, as of, November 4th, there were 184 tick-borne illnesses. And that's just within Mid-Bergen's jurisdiction. So we see about 270,000 people are in the jurisdiction. So when Deepika looks it up, she could only see the Englewood data. She can't see the other towns. So that's how I get a figure. There are 184 tick-borne illness cases. So you figure you double that. I mean, not double it, but multiply by 4 because we're about 250,000 and Bergen County is 1 million. So multiply 184 by 4, and that's what the county is seeing as far as tick-borne illnesses, just to give an estimate of it. And 174 of those were Lyme disease. So we still see a lot of Lyme disease. Maybe at the next, you could see the graph and show how the numbers have increased. If that's what you're alluding to with the
Yeah.
deer.
Yeah, because we keep talking about the deer and they have increased and that, they're all over the place, but we don't talk about Lyme, so I was just wondering.
I think as of the, end of October, we saw about, 10, 11 in Englewood report, but we don't have to investigate those, like, the state switched it back to lab only reportable, so we do get the reports, but we don't have to personally talk to the people.
Yeah.
Which saves a lot of time, and even back for that, it's difficult to track it and to get the information from the person who tested positive for Lyme disease. There also, like I mentioned, there are 4 malaria cases. All of them had traveled to Africa, but there was one case in Morris County where the person was diagnosed with malaria and they had no travel. So, and they never could figure out how this person got malaria. It was Plasmodium falciparum. You're familiar with the plasmodiums. That's one of the more dangerous of the malaria parasites. But I've seen that before. I mean, I've been doing it for a long time. That happened once when I was living in Virginia. A person had no travel and ended up getting malaria. And thank you. That's all for my report.
We went to a new business item number 7, grants.
Yeah, we've had 2 new awards in October. One was the Municipal Alliance funds, and you got a copy of the letter of intent. You'll see that the awards are still quite a bit lower than they were pre-COVID. But we do what we can with it. Most of this is being used for school programming. And the other one was already mentioned, the Mayor's Wellness Campaign, which is a community mental health grant agreement. And that's it.
Moving on to item number 8, Board of Health Attorney. Deborah.
Maybe the Personnel Committee wants to say something, I don't know. Only one proposal was received, and that was Mr. Wilson's. So, the only other thing I have to say about that is we'll have the resolution and the agreement ready for signatures at this December meeting.
I think we support that.
Item under 9, the 2026 budget.
The finance committee is meeting tomorrow with me and Jim. The draft budget is ready. This is basically for them to review it and see if there's any additional suggestions that they have before it's submitted. And it is due to the city manager on Monday. There's quite a few increases in the other expenses budget simply because some of the items for this year were charged to grants. And so with those grants being ending in March and one in June, the items are going to have to go back under our budget.
Item number 10, public health events and outreach.
I think that was pretty well covered. The only other thing I have here is this is from the Shervin Family Live Well Center, the Youth Wellness Program. And Englewood is having an emergency food drive. You got the flyer for Get Fit in the Fall and also for Wellness Wednesdays, which were described in the presentation. And also the blood drive. And
I
that,
had a question about the chronic disease self-management class that is run here in Englewood.
Yeah,
were you-
I did not have a flyer on that one, and these were when this packet was sent out.
Are you accepting people from Bergenfield? Will you accept Bergenfield residents for that class? You can't say so yet, as of yet.
I don't see why not, but let me just double check on that.
Because if you are, Bergenfield is interested in that class and running that class, and the president of the board in Bergenfield is very interested in doing it. So, we could promote it in Bergenfield if we
Okay.
send Bergenfield residents here.
Is there a maximum slot
I
allowance?
think there's only about 11 or maybe 15.
So I believe there is a certain number, but I did just confirm with Julia. She said yes, so it can be open.
All
to-
right. Okay,
Yes.
good.
Okay.
The classroom is small. You're not allowed to have a lot of the participants in there. You can't have like 50 people in there.
Yeah.
Okay, thank you. Maybe we could, if you get overrun by Bergenfield, maybe we could say, look, you could only send, we could do something like that.
So it's 15 max if I'm not mistaken, but I would definitely advise them to contact Julie so that way they can coordinate. Maybe they
Okay.
can have something separate just for Bergenfield residents, or, if maybe there could be a mix, but depending on the demand, I would definitely.
That's good news. Bergenfield would be happy to hear that.
Mhm.
Thank you.
Item number 11, is there any other business to discuss tonight?
I don't really have anything else. I'll just say I'll be at the League of Municipalities conference Tuesday to Thursday next week. And they have some very interesting workshops, should be valuable for the department.
To public comment, the board will require a motion to open the floor to public comment. A second and a vote. Speakers will have 5 minutes unless stated.
So moved.
Second,
Ms. Davis,
yes.
Ms. Rubin,
Yes.
Dr. Sadler,
Yes.
Dr. Solfer,
Yes.
Mr. Tenzer,
Yes.
Dr. Sullivan.
Yeah.
We have one on. There's no public discussion. We need a motion and a second. So more public comment.
Ms. Davis,
Yes.
Ms. Rubin,
Yes.
Dr. Sadler,
Yes.
Dr. Sofer,
Yes.
Mr. Tender.
Yep.
Dr. Solomon.
Yes.
closed session, where the Open Public Meetings Act of the state of New Jersey permits the exclusion of the public from discussions of employment matters. Need a motion in a second to go into closed session.
Second,
Ms. Davis?
yes.
Ms. Rubin?
Yes.
Dr. Souther?
Yes.
Dr. Soper?
Yes.
Mr. Cesar?
Yep.
Dr. Solomon?
Yes.